My name is Neil Desai. I'm a radiation oncologist at the University of Texas Southwestern in Dallas. So radiation therapy of prostate cancer is a wide world of scope. I think that's the most important advance in the last few years, is that radiation therapy has progressed beyond simply treating localized prostate cancer into treating advanced disease as it relapses, either regionally, distantly, in conjunction with these advances in imaging such as PSMA and flucyclovine, and all the way out to advanced disease using radiopharmaceuticals as with lutetium-177 PSMA therapies. And so really is a spectrum of care that radiation is able to draw upon now for prostate cancer patients, and that's probably been the biggest advance. Within each of those categories, on the front side for localized patients, the theme is improving therapeutic ratio, meaning improving outcomes without hurting patients as much as we've done with prior therapy. In this regard, reducing side effects from therapy, reducing logistical burden by shortening radiation regimens when able, by matching radiation modalities and regimens better to the patients who are at risk for different side effects on a different basis of their anatomy or baseline urinary function, for instance, is important. As in technologies, obviously, always a big part of this. There are increasingly use of modifiers of radiation, such as the use of rectal spacers to reduce rectal injury, the use of MR-guided radiation to delineate the prostate better and actually deliver the radiation more accurately. A lot of these are being marketed heavily and appropriately so to try and improve things, but of course the data needs to be there to back it up as well. I think the studies are ongoing to establish all of these, and globally I think that's a great theme for us, is moving in a direction forward to improve the therapeutic ratio, even for patients who are not improving necessarily survival for. In the patients who do have risk of dying from prostate cancer, just doing a better job of integrating with systemic therapy advances, integrating better systemic therapies such as novel hormonal therapies, establishing new roles for radiation in advanced setting, such as with primary site radiation in the metastatic setting. This has been a major advance because it's now clear, based upon things like the STAMPEDE study, that ablating or addressing disease in a local manner does matter for advanced patients and does extend life. And so I think a lot of studies that are continuing ongoing to explore this area are still pushing forward in the oligometastatic or advanced settings. And I think that's been some of the most exciting advances I've seen of recent years.